So, is a degree needed to get started in health information management? No, a degree is not needed. Okay, you can leverage your current level of experience to pursue job opportunities. If you're someone who has absolutely no experience, zero experience, and you're just trying to get your foot in the door, some entry-level positions that you can consider pursuing is release of information, patient registration, also working in the patient financial services department, health information specialist roles. Those are entry-level positions that you can pursue. And those roles, they're doing like insurance verification, releasing medical records, obtaining prior authorizations. Now, if you've been following my page, you know that I've also said that these are areas where I believe that AI is eventually going to take over and these positions eventually will be eliminated. So if you're still working on getting your foot in the door, get your foot in the door, obtain a position, but I wouldn't stay in these roles for longer than a year. If you're already in year 2 of working in one of those kind of roles that I just mentioned, it's already been too long. And it's time for you to start working on moving your way into the middle and the back end of the revenue cycle and start pursuing some more like analyst kinds of roles, analyst, auditor kind of roles, moving over into compliance, fraud, waste and abuse, revenue integrity, health IT. You want to start pivoting away from the front end positions because the machines are going to eventually take over that. But to get back to the point of, can you get started in this industry without the degree? Yes, you can. Can you pivot into different positions and roles without having the degree? Yes, you can. It's just a matter of where you are pursuing these kind of job opportunities. If you're working on creating your list of who some of these companies are, I just mentioned 3 in this video that you can list down, and you can kind of keep a track record and, kind of periodically go back and look to see if they have any new remote job opportunities that they have posted that do not require a degree or maybe do not require the certification as well. But in general, if you just want to know where can you find job opportunities that do not require a degree or that do not require a certification, you can find these job opportunities at hospitals. You can find these job opportunities with health insurance companies. You can find these job opportunities with consumer reporting agencies. I've talked about this before, you guys. Companies like Experian and TransUnion, they have a healthcare component as well. And some of these companies will hire you in without having the degree or the certification. You can also look for these job opportunities at just regular normal clinics and urgent care centers. These job opportunities are all over the place. They're not hidden. It's not like a secret market. And the only way you can find these job opportunities is if I tell you about them. They're posted all over LinkedIn and Indeed. And speaking of that, another thing I want you guys to realize is that not every company uses LinkedIn and Indeed to post their jobs because it does cost them additional money to post their jobs on LinkedIn and Indeed. So you don't want to just 100% apply or rely for job opportunities to be posted on those job boards. You could be missing out on a lot of job opportunities because you're not going directly to the source, which is going directly to the company's job board. Okay, some of the job opportunities that I post, you will not find them on LinkedIn and Indeed because they're only posted on that company's job board. They're not posting them anywhere else. So you really have to go outside of the box and also think outside of the box. Go into uncharted territory. That's where you are going to kind of level the playing field, if you will. Everybody's on LinkedIn and Indeed looking for a job opportunity. You should go to other places where people aren't looking. Hello everyone and welcome back to my YouTube channel. If you are new here, I am Valerie, the creator of the HIM Blueprint for Success, and I help professionals who work in the healthcare industry to strategically search for job opportunities and scale in their careers. And today we are going to talk about a topic that I get questions about all the time, which is how can I get started in health information management or health information technology if I don't have any degrees or certifications. And What a lot of people do not know is that you really don't need degrees or certifications to work inside of this industry. If you do have them, great, but if not, it's not the end of the world. I worked in health information management for the first 7 years of the 19 years I've worked in this industry without a degree or certification, and I'm going to explain to you how you can get started, or if you're already a seasoned professional who's been working in this industry and you feel like you need a degree or a certification before you can scale up in your career, I'm going to explain to you the kinds of positions you should be looking for and also what you should be paying attention to inside of the job descriptions. Now, before I go any further, I want to remind everyone that if you have not already subscribed to my channel, go ahead and subscribe. I checked my analytics and it said about like 70% of the people that's watching this channel is not even subscribed. And most definitely make sure that you turn on the post notifications, because from time to time I come on here and I share job leads, and you want to be one of the first to see the job leads. You want to be one of the first to apply, especially if it's a position that aligns with your background and experience. So you don't want to be the last person to find out about it, right? Imagine if it was the perfect opportunity for you, okay? So if you haven't already, make sure that you subscribe and that you turn on the post notifications. So the first thing I want to talk about is some key areas and misconceptions when it comes to pursuing job opportunities in health information management. And the very first thing is that degrees and certifications are employer specific. It's not an industry standard. If you've been following my social media pages for a while, you've probably already heard me say this, but I really need you to understand this, that it is employer specific. It is not an industry standard to have a degree or certification to work in this industry. It's not like, trying to become a registered nurse. In order to become a registered nurse, you have to pass the NCLEX. There's no way possible you can work as a registered nurse inside of a hospital if you do not complete the 4-year degree requirement and pass the NCLEX, right? Same thing like with becoming a lawyer. You have to pass the bar. There's no way possible that you can practice law and, be an attorney and go into court and defend someone if you have not passed the bar. That is the industry standard for being a nurse or the industry standard for being a lawyer. But the same is not true if you want to work in health information management or health information technology. The company themselves can decide how many years of experience they would like for you to have, what degrees they would like for you to have or not, and what certifications they would like for you to have or not. So when it comes to degrees and certifications, it's important for you to align yourself or look for job opportunities at your current level of experience with companies that are willing to hire you at your current level of experience, whatever degrees or certifications that you have. So if you're performing a job search and you're only looking for job opportunities with hospitals or healthcare organizations that want you to have the degree or certification, and you don't have that, it's going to become a very frustrating process. And there are hundreds, if not thousands, of companies that will hire you without the degree or certification. And I'm going to show you some of these opportunities in just a moment, so make sure that you stick around. Next thing is there's a difference between preferred versus required. You have to pay attention to how you're reading the job description. Some companies may say, we want you to have 2 years of experience or an associate's degree, right? So they're saying one or the other. And another thing to take into account is extensive years of experience. So if you're someone who's worked inside of the healthcare industry and you already have like 4 or 5 years of experience, but you just don't have the degree or certification yet, please know that your years of experience is equivalent to having the degree. And some companies are really good with being clear about that inside of their job posts that they have up. They'll make it very clear that they want you to either have the years of experience or the degree, and they kind of will break it down what they consider to be the equivalent of such. So just in general rule of thumb, if you have at least 2 years of experience, that's equivalent to having an associate's degree. If you have at least 4 years of experience, that is equivalent to having a bachelor's degree. And if you have at least 6 years of working experience, that is the equivalent of having a master's degree. And let me be clear when I say that, this is of relevant work experience in whichever area that you're looking for a job opportunity. So if you have 4 years of work experience in an administrative office, let's just say completely outside of the healthcare industry, I would not say that that is the equivalent. Okay. But if you have 4 years of work experience working in the patient access department or patient registration, but you don't have a degree, and then you decide to pursue a job opportunity that does have it listed that they prefer for you to have a bachelor's degree, but you have 4 years of work experience in the patient finance or the patient registration department, that is 4 years of relevant work experience that is the equivalent of having that degree. So keep that in mind. So I want to show you guys over here how these job opportunities look. So the first position I have up here is a medical staff coordinator with Providence Hospital in Washington State. This position is pretty much a credentialing specialist role. They don't have that listed as the exact job title, but as you read into the job duties and responsibilities, that's pretty much what that is. And in a role like this, it does not require for you to have a degree. And you might come across some companies that do prefer for you to have a degree, but as you can see with this position here, this company does not require for you to have a degree. They're looking for someone who has experience working in a healthcare setting, someone who has experience working with providers closely, also assisting with planning and supporting meetings, doing things like the agenda, notices, and taking minutes, and also record and document management. And then they get very specific here where they say coursework training and medical staff services expertise, and upon hire, medical staff credentialing specialist. So that is a certification that you can get in this role. Now, I wouldn't say that they made it like very specific that it's required in order for them to consider you for the role, like during the interviewing process, but here it does say medical staff credentialing specialist. But nonetheless, this position does not require for you to have a degree. And if you're someone who actually has work experience in human resources, you actually have transferable skills that will be valuable in this space, especially if you have human resources work experience inside of the healthcare industry, doing things like making sure that the candidate has the appropriate certification and that it's not expired. If you're working with providers and their certifications, you're making sure that they don't have any outstanding malpractice claims. And if they did have any malpractice claims, what were they for? What was the payout? So if you have a background and skill set in human resources, pursuing job opportunities in provider credentialing could be a really good space for you. And again, this is a position inside of the healthcare industry that usually does not require for you to have a degree. You might see the certification requirement. It's a position that's pretty straightforward. And in this role here, this one is remote, and the links for the positions I discussed in this video today will be in the description box below. They are paying anywhere between $28.99 on the low end, all the way up to $50.19 per hour on the high end. So it is a position that does pay very well. Another position you can consider if you do not have a degree or certification yet is an appeals and health benefit analyst position. This is a position here with Johns Hopkins Health System in Maryland. This position is remote, but it is specific to or targeted towards people who live in Maryland, DC, Virginia, Pennsylvania, Delaware, or Florida. It says they will be given first consideration, but it doesn't say that they are not willing to consider someone who is outside of this region, out of these states that they have listed here. So if you have experience in this area, or if you're interested in working in a position like this, then I highly recommend for you to consider applying for this position. They are looking for someone who will communicate with both internal and external customers concerning benefit interpretation, appeals, disputes, and claims issues. So that more so sounds like you will be speaking with patients who might call in and have questions about the explanation of benefits or a claim denial that they received, or even if it was paid, they may still want for you to explain what happened, or you may have to speak with some insurance companies when it comes to coordination of benefits, right? If there's a primary or secondary payer. Okay, also research incoming appeal disputes and prepare written response, and also have a knowledge of Medicare Advantage claims, disputes, appeals, insurance regulations, and managed care to explain procedures to vendors, providers, and customers as well. Act as a resource for claims and customer service and care management and sites. Pretty much what I just said, having these conversations with patients that might be calling in, and then also responsible for review and payment determination of claims pending for determination resolutions. Also work on inquiries related to grievances and disputes. They are looking for someone who has 3 years of experience in an insurance setting, Medicare experience preferred, also knowledge of Medicare guidelines and regulations, knowledge of providers and member appeals and disputes rights and responsibilities, able to read and interpret providers' contracts and members' explanation of benefits, and knowledge of regulation guidelines for insurance complaints, and knowledge of medical claims process and revenue cycle, and then also understanding of medical terminology, CPT and ICD-10 codes, and also revenue codes, and of course, customer service skills and problem solving skills. So to me, this sounds a lot like you will be interacting with patients a lot on the phone. So this is one of those telephone roles, I would say, for sure. And if you are someone who has a medical billing background, patient financial services background, more than likely you have valuable skills that can be leveraged in this kind of role if you kind of want to pivot over and start working with the health insurance companies directly. But this is pretty much what you would be doing in this role. This is the appeals and health benefit analyst position 1. It is a remote position, and the salary range that they have listed for this role is starting at $20.22 per hour all the way up to $33.38 per hour. As we noticed in this position, it did not list any requests for a degree or certification at all. So if you are someone who's already been working in the industry, you already have some years of experience, and you're currently making under this amount here, 33, 38, and you are looking to increase your income, and you live in this region, and remember, they're also considering people who are outside of this region. They're just going to consider these folks first. Then I would highly recommend for you to consider this position here. All right. Next position that you could consider if you want to work in health information management and you don't necessarily have the degree or certification yet is this revenue cycle compliance analyst position. This also is a remote position. This is with Accession, and they're located in Wisconsin. And this is the one I wanted to show as the example when I say you have to pay special attention to how the job description is listed. Now, they do have listed here that is a requirement to have the CCS certification. Now, in order to get the CCS certification with the HEMA, there's no degree requirement. You don't have to have an associate's degree or a bachelor's degree to qualify to sit for the CCS certification. You do have to complete a medical coding program and sit for the exam and pass that, but you do not need a degree. Now, here it says high school diploma with 2 years of experience or an associate's degree or bachelor's degree, right? And then here it says, or 4 years of job specific experience required. So that means that, yes, they want you to have the CCS, but they also will prefer for you to have the associate's degree. If you don't have the associate's degree, 2 years of experience will suffice. Or they want you to have a bachelor's degree. And if you don't have the bachelor's degree, the 4 years of experience will suffice. And the more you read through job descriptions, the more you're going to notice this kind of verbiage being used. So if you're someone who's worked inside of the healthcare industry and you have the years of experience, but you don't have the degree or you don't have the certification, you want to pay special attention to job opportunities with companies that value the work experience just as much as they value the degree. I worked inside of the healthcare industry for 7 years before I had a degree or certification. I worked in roles like health information specialist, unit secretary. I also was an office manager for a home health care agency. I worked in patient registration as well in the emergency department. All of those roles did not require for me to have a degree or certification. These are just 3 that I have up here on the screen, in addition to some of the ones that I just mentioned that I personally worked in. But there are a lot of different positions you can work in inside of the healthcare industry without a degree or certification. It's just a matter of the companies that you are aligning yourself with when you begin your job search. All right, so I hope that you enjoyed the information that I shared in this video. If you have any questions for me, be sure to drop it in the comments below. If you haven't already subscribed, make sure that you subscribe and turn on the post notifications so that you do not miss a beat. If you are a professional working inside of the healthcare industry and you're looking for your next job opportunity and you're ready to take your career to the next level, especially if you've already been working in this industry for longer than 5 years and you have not made it past the 70K range annually and you're ready to take your salary up an additional 25%, check out the resources that I have listed below for professionals just like you that's ready to take their career to the next level. As we all know, inflation is out of control. It is up about 21% in the last 4 years. And you have to make sure that you are outpacing inflation, okay? If your salary is not outpacing inflation, it probably does not feel like the dollar is stretching as far. And as a career professional and the CEO of your career, you have to take total control of your career. You cannot put your salary in the hands of your direct manager or the company that you are working for. If it's just moving too slow for you, it's not 100% up to them to make the change. It is 100% up to you, and you 100% have the power to do so. There's a bunch of job opportunities that's currently posted right now, and one of them is waiting for you. They just don't know that you exist. Until next time.